Okay, so here we are. Medicine for ceremony. Take whatever. So I'd really just love to hear about your experience, like what it was like for you to go to South Dakota. Then I'll ask questions.
It was pretty welcoming. Getting to go to South Dakota on this medicine adventure, cultural experience. It was I don't know. As much as we tried to prepare, there was nothing like being there. I think just the warmth of the community was felt. It was a good experience in that regard. I didn't anticipate.
Well, we warned you that they might be unfriendly.
No, they were friendly though. It was great.
Yeah.
They were very welcoming people.
So maybe tell about a high point for you. I know it's hard to pick the highest point, so just any high point will do.
One of the high points of the trip, I think, would have been the journey to get the tree.
Mm-hmm. I should put that in the cup. Oh, I see. Tea is coming. A different kind of tea. Blueberry tea.
Ooh.
Yeah, so maybe tell a little bit about getting the tree.
So the gathering of the tree was very ceremonial. It was a little trek. It wasn't far, but it was a distance. I can't really estimate how far it was, but I remember walking for a little ways, and everyone was just lines of people walking on this trail. It was beautiful.
Yeah.
All towards this tree, and there were people waiting, and they said the beginning prayer to the tree that they had selected. There was a sash tied around it, and then I loved how the children got to do the ceremonial first acts of the tree. They all lined up, in their headdress, and it was beautiful. And they all took the first whack, and then all the men lined up and took their whack. And catching the tree looked quite dangerous, but fun. And it's beautiful because they didn't want the tree to touch the ground because it represented so much to them. And
yeah,
it was just nice. And then everyone gathered afterwards because it's not supposed to touch the ground.
We're having this ceremony of the selection of the tea. So many choices.
I like that one. Thank you. I appreciate it.
Was there a low point to the trip?
The bathrooms.
The bathrooms.
That's easy.
That's easy.
They smelled.
Yeah, they did.
The bathrooms were the low point. So there was 2 of them for everybody there, except the dancers. The dancers around the side, they got to use another one, which was nice. Closer to them, but
yeah,
for us, there was 2 bathrooms. And at night you go to go explore behind your tent, but during the day they just smelled so bad.
They did. It's true.
I don't know. What's the low point for you? Like, you got to be in the middle, like in the center, as a dancer. That's a different experience.
Yeah. I think the low point was, mm,
Thank you.
that's a good question. I didn't like that I forgot my earplugs when I was splitting wood. That was probably the low point for me, was I was
Okay.
like running the wood splitter, and it was really noisy, and I didn't have my earplugs because I brought some earplugs because I remembered that the wood splitter was really noisy, and I didn't have them, and there wasn't any way to go get them. So that was probably the low point for me.
That's really frustrating.
Yeah, yeah. How about some stories about people that you treated?
Oh. So I guess I'm going to start from the beginning of the people that Nicole and I got to treat while we were down in South Dakota. We drove south first, outside of Yellowbird Canyon.
Yeah,
Yeah. And that was great. That was a great experience to get to meet all those people, cooking in that big kitchen. It was really fun. I enjoyed that. And we made some delicious soups. And I don't know. The people we treated, I guess we started. I don't know. We started with a few different people. Just sitting around the table. They asked us about our profession, and we started explaining what osteopathy was. And they were interested in the hands-on treatment that we are trained to do. And we just started doing some.
just
We just started doing some treatments around the table at first. She was treating the knee, I was treating a hip. While seated, and the hip on the seat is really difficult. And they had a massage table upstairs, so we brought it downstairs, set it up. And I don't know, it was good. I did some stills technique, which is like a articulatory rotation type of technique, and some long labor, which is like a BLT type technique. No, it's a limited tension. Sorry, I guess I should define things.
for those of us who don't know what it's called.
Right.
Yeah.
Right. Exactly. And I don't know, it was really nice just getting to have people who are open-minded and respect our way of doing things and want to see what it is and teaching us about their ways. Like, it was really cool. We got to sit around the table and Chum just told us that whole story. Apparently he doesn't talk too much. He just sat there talking to us for like an hour.
Yeah, I heard about that.
And it was really, it felt really like it was an honor to just get to hear his stories about his experiences and people and what he does with the community and carries on the tradition. Like, he speaks the languages and I don't know, he was just really cool. Like, there's 3 horse tribes that is around that community, and he goes to each one and some others and tells stories about the elders and the old battles. And he shared some of those stories with us. And it's just really admirable that he still does that for the community each year.
Mm-hmm. Yeah, yeah.
And I don't know, that was an hour after we treated him or so it was really nice. Like, his daughter, like, you get on that table, and that's how Becky is, apparently. And, yeah, she just told him, get on the table. So Nicole and I got to treat him together, which is really fun when you get to treat with somebody else. We don't get to do that in the clinic all that often, so that was a special part of this trip for Nicole and I, both, I think.
He has years of wounds.
Yes.
It's like injuries from.
Some of them are very deep and locked up, and they're going to stay there, and that's okay. Yeah. Sometimes you get very deep, and he told us something later that Nicole and I looked at each other and were like, oh, that's what that was. Because you can feel that. It's very powerful.
I love the story that Nicole told us when we were talking to her about the taping up the dialysis catheter.
Oh my god, that guy was so funny. He was from Canada. I forget the tribe's name, but somewhere up there in Canada. Do you know?
I don't know. Do you remember? Was he Cree?
I think he's probably Cree or Ojibwe.
Maybe.
Anishinaabe, maybe.
Anishinaabe. He was from, I don't remember.
That sounds like something, yeah, something like that. May I have some water?
Yeah.
Thank you.
People come from all over, so. There's do you want ice or no ice?
A little bit of ice, please. Thank you.
So I guess he was a little skeptical at first.
So first, he didn't believe me that I was a doctor. And I think it was more because of my age than because I was a female, like, just to clarify.
Or maybe because you were there.
Maybe a little because of that. I don't know. But it was a dialysis catheter, and he just wanted people to go in the sweat lodge, and part of it was coming off of his chest. And he wanted to be sure it was staying in place because he had to use it a few days later. And he didn't believe me that I thought duct tape would be the best thing to use out there.
Yeah.
You know, it's really a strong, sturdy tape. If you put it on when it's dry, it's going to stay there. Put it in that shape. And he's like, no way. That's not a good idea. That's not, you're not a doctor. That's not what a doctor would do. Yeah, all right. When they go walk to go get the duct tape, I'm going to go get Nicole, who's my doctor friend. She's going to come look at it. And we'll see what she says. Thank you.
And it apparently worked fine.
So then Nicole helped me put the duct tape on. And apparently it worked. We saw him the next day, and he was like, hey, thanks. And I don't know how your guys' sweat lodge was. He was in there, right?
He was in the community lodge, wasn't he? He didn't go in the dancer's lodge. I don't think.
No, probably not.
I'm not sure. He was in the lodge that Wiley poured.
Oh, okay.
Wiley poured a lodge in the evening after you guys had done dancing. He went and poured
For the community.
For some guys in the community. Yeah,
Sort of honored elders.
Nice.
Well, yeah, it wasn't for everybody, but
Yeah, that was pretty cool. So, did we meet our goal? Do you feel like you're more prepared to talk to future patients about their participation in ceremonies vis-a-vis their health problems? And
I definitely have a better understanding of what actually happens there. You know? I mean, it's quite an experience
Yeah, it
to
is.
get to see everything. And I don't know, I didn't get to finish talking about the tree.
Oh, okay. Okay.
So there's another part. So after cutting down the tree and bringing it back, respecting the tree, we all lay out sashes and lay it down because it can't touch the ground, right? They all respect the tree. So everyone lays out their sashes and covers everything, including all of the branches, and everyone waits very cautiously until it's all covered. And then there's a hole, and it's lined up right in front of the hole. And everyone then, in front of the hole, lines up in two lines. There was 2 lines of people, and they go to give their offerings. So, it's all their offerings to the tree for the year. And it's it's a festival. Festival? Can I call it a festival?
You could. Yeah.
Okay. For health and wellness and prosperity for the year, as my understanding. And everyone lines up in these lines, and then they take their offerings, which is a mixture of tobacco and
Sage. They had
sage.
and they had
there was something else.
was not. They had the beef, like the ground. It's dried.
There was something sweet smelling.
It's the dried meat with blueberries in it.
Dried meat with blueberries in it, apparently. Yeah. And it was all this ground mixture, and it was all mixed together. Next time you grabbed a handful, then you lined up to it, and then you got on your knees and you said your prayers to it. You dropped it in and got up, and the next person did it, and everyone was barefoot. It was very respectful. You touch the ground. Say your prayers to the tree. And then all the men dancers with their ropes. I'll get back to the ropes at some other point in time. I guess we gotta talk about that. And then they all grab their ropes around the tree after they're all tied up. They hoist up the tree, put it in on top of everyone's prayers, cover it up. And then there's the prayer ties. The everyone ties around it. And it already has all these flags on it. There's a buffalo and a man. I don't know if it's paper or what it is, if it's some sort of heavy fabric. I don't know. It's stayed on the tree. And then there's a whole bunch of branches tied around it, and that's the eagle's nest. It's all very symbolic. And then everyone ties their prayer ties around this tree after it's all propped up. And you walk up to it, you can tie your prayer tie on. And there's another part of that later in the festival. That's the beginning of it. And I think that's all really cool. Like the respect to the tree. I don't know. There's just so much about it.
Yeah, a lot of respect. Yeah. The and I think our other goal, the first goal was to know more so as to be more able to inform people who have questions about their health problems who want to participate. And the second goal was sort of cultural immersion, to really absorb the culture in a way that just talking about it wouldn't permit. And I wondered if you could speak to that a little bit.
To the culture?
Yeah, do you feel like you got a sense of the culture in a way that you hadn't understood before?
Yeah, I think the casual nature of the sweat lodge, and like that's just a part of the daily life. It's an interesting culture, and everyone eats together in the meals, and I really like that community kind of feel of the culture. And I don't know about that part, and I guess I don't know how that'll really in medicine, except maybe it'll be a really good community to do group medicine. I just thought of that. I
Mhm.
didn't think about that before. But that aspect of the community, and they all really like to do things together.
Yeah, yeah.
Hmm.
And if I remember, you're thinking of going back to the West.
Correct.
Where are you thinking of going?
Either Oregon or Western Montana.
Yeah, and there's a lot of these
Washington.
ceremonies going on there.
Yeah. So I understand that there's a large community there.
Mhm.
It's still very
Hot tea. Yeah. Do you have any other things we should ask or debrief or?
No, I guess it's all folded in for me, the culture and the ceremony is that, I wonder if just knowing about the ceremonies helps in knowing about the community and kind of all the stuff, would help you with a client, just knowing, like that those things are in the picture.
Yeah. So one thing that I know about that community in what I do, and being a doctor, that is physical exam. If I see certain scars on the front or back, I will know what part of ceremony that they participated in, and I won't have to be so confused about those types of scars and have someone have to explain the entire thing in the office to me, because I think that would be a lot for someone to have to do, because the festival is very deep to try to understand and explain in that 15-minute visit that I'm expected to have with anybody. So they can just say, yeah, I participated in ceremony, like, cool, how many times? And then we can keep going. I think that's pretty cool.
Yeah, I would think they would probably trust you a lot more if they didn't have to explain what that was all about.
Yeah,
Mhm.
probably.
Yeah.
And apparently when we left, so I talked to Nicole afterwards, who apparently talked to Adrian. Adrian was one of the people we cooked with there, so I'm thinking of another idea that I can help with at the ceremonies right here. Apparently, Adrian told Nicole that after we left, a certain amount of people got sick. Like, some were vomiting and had diarrhea, so different GI symptoms. So we need to promote better hand washing while cooking, and different procedures like that, and keeping food along those, like public health measures. I think that would be a really good place for us to be able to make improvements if the community was willing. So we'd have to introduce it respectfully. I'm not quite sure how I would do that there yet. It's an interesting culture to be able to ask for change, because things are done a certain way for a reason sometimes, and sometimes I don't understand those reasons. And I never want to be rude to ask, so it's nice to have someone there that you might trust to ask before someone or you just start doing things.
I think that
I would recommend that.
I think that points up a real issue in working cross-culturally, is that how do you start making suggestions in the right way? Because it is complicated and relationships are different, and walking in and saying for public health reasons we need to do this, is not how that culture would respond.
Right.
So I think you have great insight now into the complexity of respectful change and saying, here's some things we might want to think about.
And it's probably as simple as not having enough refrigerators.
Well, I also would wonder whether the food was the source of this, because there's other areas where you could see there would be transmitted bacteria that,
There are other areas where you could see where things could be transmitted. I agree.
and so I, because the kitchen people are relatively speaking aware of that, and we're
Correct.
conscious. Certainly.
Yeah, and one of the things that Adrian told me, the kitchen people are pretty conscious of the health procedures. Adrian told me that when she first got there, she's the one that introduced, after a few years, of course, introduced the Lysol wipes to wipe down the countertops and the grills.
Yeah.
And the pans, because it's you can't use a lot of water while you're out there. You have to go inside to wash the dishes, and at certain times you're just not supposed to use water because it's going to bring rain, and you don't want to bring rain to the dancers who are sleeping outside during the ceremony.
And also because the dancers aren't using water, so you're trying to kind of respect the sort of idea of the ceremony.
Right, and also, because the dancers are not drinking, you would respect that process of them not drinking themselves.
To really think about water. But yeah, it's a good question.
So how much is that worth, washing the dishes for? So the Lysol wipes are very valuable in that environment. But it's something that I don't know how it would change, and I don't know how many. There's a lot of dances out there, so like, how are you going to make a big change like that? Like, one dance is one thing, but there's so many out there. Who knows how much this goes on?
Yeah, and that is really I think the learning point is that one can't just walk in to a community like that and say do it differently. Mm-hmm. One has to somehow become part of the community and then kind of move things in a certain direction over time, which is really participatory action methodology. That's sort of what's being promoted for research as well. Is that we become partners. First, we form relationships and become partners and share what we know with each other, and then we consider what are the problems that everybody agrees on, and how might we address those. Yeah. I read a really fascinating paper from the Caribbean about using that approach, that methodology, to address sexual abuse in indigenous communities. Mm-hmm. And that the really important thing is that the experts not come in and lecture and point. And,
right.
Yeah, but to just wonder, how do people feel?
Yeah, I mean, you have to adopt. You have to blend in respect to get in, to gain access into different communities. Trust before you walk in and try to make change to anything.
Well, when I think about Barb's example of the Italian community in Toronto in the 50s, and so the social workers were trying to convince the Italian immigrants to stop using dirty vegetables and to use clean vegetables out of cans.
Yeah, to stop using vegetables that came with all that dirt from the garden, and to use canned vegetables because they were properly treated and preserved, and a lot of the Italian mothers, of course, ignored them. But I know a woman who did her PhD thesis on kind of the politics of food like that.
So sometimes the experts are wrong.
Yeah.
And they've had that experience.
I don't know. I feel like you just like anyway. You can't just walk in and like, rah, 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 like be so patriarchal and just I'm gonna make you do this because X Y Z. Like you gotta in there and you know, teach them and learn from them.
Well,
Amazing.
we've even seen that in the hospital. That occasionally when people come from other hospitals and walk in and act like they know the right way to do it and everyone else doesn't.
Oh, I'm sure.
Yeah, I mean, even if they're right, it doesn't go over well. You know? So I can think of one person who was particularly ostracized for doing that.
Yeah.
In the 5 years that I've been at this hospital. So probably wherever you go, you have to enter.
Absolutely.
With light
There's
footsteps.
volumes have been written on how to create change, how to respectfully, you know, invite change in and change practices, and there's many different thoughts on what to do at the level of using wipes. You know, it's a surprisingly loaded question.
Right. And like you just never know. Like you just never know in each community. And before you just go in and assume like it's no big deal because it's no big deal in your culture
Right.
to have that type of cleanliness. You know, maybe there's a reason. Like another thing, like and I know there's a cultural reason for this, but like spirit plates, that's disgusting. But that's okay. Because they have to be there. Because they sit there for multiple days. It's one plate that you put a little bit of food on, and you leave it there. And I just wish they got to be thrown away after 24 hours because they all get to be left there multiple days, as long as the festival is.
And in some communities, the spirit dogs eat them.
In some communities, the spirit plates are taken to a place where they're more likely to be accessed by spirit animals.
Sometimes animals
But
eat them.
I mean, the
apparently.
idea of the spirit plate
That would
is
be
you're
great.
respecting where the food came from
I
and
know.
being
It's a
grateful.
respect to food. You're being grateful to the spirits who you allow you to eat. And oh man, did we eat? We had so much food all the time. It was great. We prepared food, which is a really great job to get to do with people, get to know them, learn from them, learn from their recipes. But I wish it got to be you're saying.
Yeah.
I haven't. Yeah, their practice was to have the spirit plates in the kitchen and kind of line them up.
Really?
Yeah.
That I didn't notice.
No, I would have put them on the. Usually we put them on the altar.
Yeah.
And the altar's far away,
And they disappear.
And they disappear.
That would be great.
Yeah.
Yeah. But that's another that is a thing. I mean, I was thinking that about the wipes because I think the wipes are. I hadn't heard. I hadn't heard that people got GI, and there's many different possibilities. There's a virus was going around and people got it. There's the sanitation from the latrines, which
there's a lot of possibilities.
There's a lot of possibilities.
Could have been from the latrine.
Exactly. And because the kitchen prep areas, by the time you guys left, we left, the kitchen prep areas were pretty scrubbed up and routinely scrubbed up. And so you'd have had to have really just dived into some not thoughtful. But we live in a culture where people overclean. We live in a culture where people get out, kills 98% of everything, and wipe down everything with that, including themselves. So, and one thing I heard, for example, at the sweat lodge, at the Anithi, you sweat a lot, and at Eagle Butte, after sweating, they give you a barrel and a ladle, and the idea is that you wash yourself off. And part of what you're washing off is the things you let go of in the lodge that came out of your body, and they say it's not sweat, it's the things you're letting go of, and then you wash them off.
Right.
Now, an elder at our other Sundance surprised us by saying one day that actually after the lodge you should keep the stuff on you for a couple of days because it's medicine, and then only wash it off after a few days. And I found that really challenging because I find that my cytokines get very active when I'm sitting around after lodge without rinsing. So, and that's different from Eagle Butte, where they would say, no, you rinse off right away. So there's some really different practices regarding that. And I,
and the sweat lodge is a different part of the medicinal health experience of being there, I suppose. And what I really like is the casual nature of it. Like, it's just so natural. It's part of the culture. You just, you go use the sweat lodge. And what you were saying is there's a very spiritual part of it. And after you sweat out, it's not just the physiological aspect of the sweat on you, but it's the spiritual things that you're letting go, the things that you have accepted. And I don't know. Maybe it's more to some other people. Maybe it's the prayers that they've said on the inside. The medicine's working. I don't know.
I know from some of the old books from the 19th century, it was a common Lakota belief to wash off afterwards. So our friendly Adonisani elder is well, he's not Lakota, so I guess he can take that position, but it's definitely not a Lakota position historically.
well, and I think what you're saying about it being casual, at the Sundance, they do it as part of the lead up to the ceremony to get everybody ready by really purifying. But Becky has a lodge, and they go in any night they feel
right.
called.
That's what I was thinking.
Yeah,
that's what I was thinking. The casual is just like, that was just so cool. Like,
yeah,
of course, yeah. Of course, we're sweating.
yeah. And they go in, and it's like, and the lodge, takes place at whatever time of day. And in this case, that when we were there, Becky didn't get back till midnight, and we went ahead. But I've also been there with Becky at times when she was doing the lodge every night when she came home, and it would be, at 9 or 10 o'clock at night, and then dinner would be afterwards. And that was just how Becky ran her day, where she would go out and she would come home and she'd do lodge, and then she'd, then dinner would happen. She'd make dinner. And then she'd go to bed and get up 4 hours later and start the whole thing again.
Yeah.
Right. And that's what she would do. And,
Yeah.
and like, I don't know, Becky just seems like that kind of really. So what she said, get up and go, sweat lodge, 11, sleep, wake at 4, dinner somewhere in there,
Yeah.
big soup maybe,
Yeah.
big community,
Yeah.
big community dinner.
Yeah.
Oh,
It turns the
ringing
sound off.
again.
Yeah.
It's really loud in my ears when that happens.
Well, I think from my point of view, we've had a good discussion about the rotation, and I really enjoyed having you guys there. I thought it was great fun.
Yeah.
Yeah.
I really enjoyed that experience.
Yeah. And the community seemed to really enjoy having you guys too.
Yeah, I was surprised. I wasn't quite sure how much they were going to respect, like, a physician, and there's, and I'm wondering if both of us being osteopaths were they did help, because that's what we did when we were there. And it's not like anything against MDs. And I think learning alternative ways always will put you in a good position, and as long as you're open to new things, I think anybody can be respected in that community.
Mhm.
It's just when you walk in there, it's like, oh, we're doctors, and I think that really helped. But then when they learned more, it was an element of respect,
Mhm.
which was really surprising. That was nice.
Mhm.
I think you
It
guys
was a good
did
experience.
very well by, you came in and you just started helping
Yeah.
and you worked hard, and then it turned out you were doctors and they thought that was awesome.
Yeah.
That you guys were.
We were very helpful.
Yeah.
And I think she makes a point like that. It's very easy to gain.
Well, I'm not
Yeah.
saying easy.
Doing a lot of things.
Not easy, but I think it's an aspect of respect that you get if you show yourself. You're a
But
doctor.
of course you're gonna help, I guess. I don't know.
Well, not everybody does. People
Yeah.
come in and decide that.
Yeah, I guess that's true. Some people didn't help, and I was sort of surprised by that, to be honest. But that's okay, I guess.
Yeah.
Do you want to say something about whether you'd recommend this for other residents as an experience?
If you're open to sleeping in a tent and learning new ways and keeping your mouth shut for a few days, yeah, I would recommend it to a few residents. And it's an amazing experience. You get to be able to learn this new culture. And they have a lot to teach, and it's always fun to learn new things and learn new ways. I really appreciate you guys for allowing us that opportunity.
Yeah. Great.
Yeah,
Yeah.
thank you.
Thank you for coming.
Or my earrings.
Yeah. Yeah. Got your earrings. Yeah. All right. Well, I'll turn off the recording. We'll say sayonara.